Hello and welcome to Pregnancy Info. Have you recently done a blood test and seen something called ESR written on the report? And now you are wondering, what does it even mean? Should I be worried? Especially for women, a high ESR level can be a silent hint from your body that something is wrong. But don't panic just yet. Today we are going to talk about ESR in a very simple, clear way. What is it? Why it get high in females, what symptoms to watch out for, and what you can do about it. Let's begin. What is ESR? Erythrocyte sedimentation rate. ESR is short for erythrocyte sedimentation rate. In simple words, it is a blood test that checks how quickly red blood cells settle at the bottom of a test tube in 1 hour. Normally, red blood cells settle slowly, but if there is inflammation in your body like an infection, autoimmune issue, or chronic illness, the red cells become sticky and settle faster. This results in a high ESR reading. So ESR doesn't tell you the exact disease, but it gives doctor a big clue that something unusual might be happening inside your body. Why do women often have a high ESR? Now let's talk about the real question. Why does ESR go high in women more commonly than in men? Here are the most common reasons explained in simple words. Number 1, hormonal changes. Every woman goes through hormonal shifts during menstruation, pregnancy, and menopause. These natural changes can temporarily affect the immune system and trigger mild inflammation, and guess what? That's enough to raise ESR levels. So, if you have done a test during your periods or right after childbirth, a slightly high ESR is not a surprise and not always something to worry about. Number 2, anemia. Especially iron deficiency, anemia is one of the most common health issue in females, especially in South Asian countries. When your hemoglobin is low, your blood behaves differently. Red blood cells lose their normal shape and flexibility, and this can cause them to settle faster during the ESR test. That's why anemia often leads to a falsely high ESR even when there is no serious inflammation. Number 3, autoimmune disorders. Women are most likely to suffer from autoimmune disease like rheumatoid arthritis, lupus, or Hashimoto's thyroid disease. These conditions cause chronic inflammation, something slightly and silently, and that's reflected by a constant elevated ESR. So if you are dealing with unexplained joint pain, fatigue, or skin issues along with high ESR, your doctor might recommend further tests to check for autoimmune disorders. Chronic infections. Certain long-term infections such as urinary tract infection, tuberculosis, or pelvic inflammatory disease are common in women and often go unnoticed for weeks. These infections can silently raise ESR levels. So if your ESR is high and you're experiencing discomfort while urinating, fever, or lower abdominal pain, it's time to investigate deeper. Number 5, thyroid problems. Thyroid disorders, especially hypothyroidism and hypothyroidism, are quite common in females. These affect metabolism, hormone, and immune functions. All of this can lead to inflammation, indirectly causing ESR to rise. So if your ESR is high and you feel tired all the time, are gaining or losing weight without reason, or having irregular periods, don't forget to get your thyroid levels checked. PCOS. PCOS is a hormonal imbalance that affects the ovaries. It can cause irregular periods, acne, unwanted hair growth, and infertility. But did you know it also increases the body's inflammation level? That's why women with PCOS often show higher ESR values even when they don't feel very sick. Stress and poor lifestyle. Let's not forget something very important: chronic stress, poor sleep, lack of exercise, and unhealthy diet. All these factors create low-grade inflammation in the body. You may not feel it, but your blood knows, and it will be appear in the test of ESR. The internal stress shows up silently, telling you that your body needs rest, nourishment, and balance. What is a normal ESR level for females? For females under 50 years, up to 20 mm per hour is considered normal. For women above 50, up 30 mm per hour is acceptable. But remember, normal ranges can slightly vary from lab to lab. Always discuss your results with the doctor who understands your overall health. Symptoms that should not be be ignored. If your ESR is high and you're experiencing any one of these symptoms, don't ignore them. Unexplained tiredness, muscle to joint pain, fever without infections, irregular or painful periods, skin rashes, hair fall, weight loss without dieting, night sweats or chronic body aches. These signs are indicating an underlying condition that causes chronic inflammation. How can you lessen ESR naturally? If your high ESR is not caused by a serious disease, you can help lower it naturally by adopting these healthy habits. Number 1, eat an anti-inflammatory diet. Include turmeric, ginger, garlic, berries, green, leafy vegetables, flax seeds, and fish into meals. These food calms down inflammation and support immunity. Number 2, stay hydrated. Water helps flush out toxins and support all body functions including blood health. Number 3, manage stress. Chronic mental stress, chronic physical inflammation, try medications, meditation, journaling, or nature walks. Exercise regularly. Gentle workouts like walking, yoga, or cycling improve circulation and reduce inflammation naturally. Treat the root cause. If anemia, thyroid, or infection is causing the problem, follow your doctor's treatment plan. Fixing the root cause will automatically bring ESR level down. When should you see a doctor? If your ESR is just slightly high, don't panic. But if it stays high in repeated tests or if you have symptoms, always get a full checkup. Your doctor might suggest other tests like CBC, CRP, thyroid profile, or even ultrasound depending on your symptoms. Conclusion. Remember, ESR is not a disease, it's a warning sign. Your body might be fighting something silently, and ESR is just a way to raise the red flag. So listen to what your body is trying to say. Stay healthy, get regular checkups, and don't ignore the signs. If you liked this video and found it helpful, don't forget to subscribe for more women's health content and share this with someone who needed to hear. Thank you.